And I think we are live. So hello, everyone, and welcome to tonight's Rewire News Group event, The Unsung Heroes Who Make Abortion Care Possible. I'm Galina Espinoza, the president and editor-in-chief of Rewire News Group, and I could not be more thrilled to be moderating tonight's incredibly timely, relevant conversation. We could talk about this for hours. It's going to be a good one. But before we get started, I need to get some quick housekeeping stuff out of the way. First, we've got a great audience signed up for this tonight, which is super exciting. Thank you all for being here. You can see us, but we can't see you. We are keeping you hidden, and we are also keeping you all muted because we found that's the best audio and visual experience for everyone on the call to have. However, we do want to encourage questions. So if you have a question at any time during the event, please just scroll down to the bottom of your Zoom screen. There's a bar across the bottom of your screen. You'll see a Q&A icon. If you click on that, you can drop your question in there, and I'm going to be monitoring that throughout the event and throwing to questions. So please feel free to put any questions you have in that Q&A icon. We're also going to be putting some important information into the chat icon, just basic stuff about who we all are, what we're talking about, as well as the email you want to use should you have any technical issues. I'll tell it to you now, just in case. It is events@rewirenewsgroup.com. We have a staff member on standby should any issues arise, so please feel free to use that should you need assistance. All right. Now we can move on to the good stuff. I'm going to start by introducing our panelists. Joining us tonight, we have Andrea Raby, who is the director and producer of Undue Burdens, which is the documentary film that serves as the basis of our discussion tonight. You should have all received a link to the movie, but it's okay if you haven't already watched it, because after tonight's conversation, you're definitely going to want to check it out. And it's short, it's really thought-provoking, and it also is hopeful as well. So I highly, highly recommend you check out Undue Burdens. We also have Sydney Bauer, who is the impact producer for Undue Burdens, and she also has a day job as the membership and partnership coordinator for the Network of Executive Women, which is a nonprofit that works to advance women in the workplace. Diana Parker is with us. She is the executive director of the Midwest Access Coalition, which is based in Chicago and is one of the organizations featured in the documentary. In her role, Diana works with partners across the country to collaborate on the support and care for patients along their abortion journey. And as we're going to discuss, it is a literal journey. And finally, we have Devin Gossberry, who is the Director of Training and Client Coordinator for Midwest Access Coalition. She is also a doula, and I believe she might be on call tonight. So if Devin suddenly disappears, you will know why. Andrea, Sydney, Diana, and Devin, thank you all for being with us here tonight. All right, let's get to it. I'm going to open the conversation with a question for our director. Andrea, I've actually watched Undue Burdens several times now. And every time I watch it, I'm struck by the feeling that if I were to just close my eyes and listen to the stories, I would have no idea if the person talking about their abortion experience was a present day person when abortion is legal, or someone from the 1960s when abortion was illegal. And I'm just curious to know if that was your thesis going in, or if that was kind of what emerged as like, oh, this is the story as you were conducting your interviews.
Yeah, so I think a little of both. I think I was struck by how kind of the urgency of the activism of both times. Like before Roe, it was we need Roe to be able to access safe abortions, and now it's we have Roe, but we have all of these other smaller laws that people might not see on the surface level that are preventing people across the board from gaining care. So I think it started off maybe a little bit more like, oh, this is interesting. Let's look at this like activist group that was working before Roe v. Wade, and another activist group that's working now to help provide care. And then I think more and more the similarities of what people are dealing with came about, and it started to feel, I guess, not scary. I wouldn't say, that's a little bit too harsh, but it's like, look at how important groups like MAC are, because accessing abortions is as difficult as if abortions were illegal for people in rural areas, for people of color, you have it. But so yeah, so it kind of grew out of seeing some of the similarities when I thought I would see more differences, I would say.
Yeah. One of the differences that is mentioned in the film is this idea of information, understanding about our bodies, understanding about the systems. And I think there's one interviewee in the film who says in the 1960s, she didn't know if she'd ever even heard the word vagina said out loud. And so she talked about how much more complicated it was because there wasn't that kind of basic information. Today, of course, we live in an era of information overload, and yet it's still the same situation. Having all this information, knowledge has not equaled power necessarily for those who are seeking abortion access and care. Sydney, as the impact producer for the film, I'd love to hear from you as to why you think why you think that all of these factors that should be improving the way that folks are able to access abortion really have not turned out to make much of a difference. And I'll remind you that you're muted, so do unmute yourself.
I had the cursor poised right over the microphone, so thank you. And thank you so much, before I begin, for having us. I think you make such an important point in saying that we live in an era of information. And I think it's also important to point out that we also live in an area of increasingly misinformation. So although there are fantastic organizations like MAC and other abortion access supporting organizations, there are a lot of other folks, whether it's just citizens of the United States or other formed organizations that are working to put out information that misinforms people. And even we were at the Beloit Film Festival with Undue Burdens, and in the Q&A, a audience member actually asked us what our thoughts were on partial birth abortion. And she had asked questions previously, and it, even in that moment, we had to that's actually not real. That's actually misinformation and has been misrepresented. So especially as media makers and looking at the impact of our media, it's getting, our jobs are getting harder and more important to make sure that everybody has the right information, not just a lot of it, and that it's communicated clearly.
Yeah. Diana, you of course are doing this on the ground work right now and seeing in real time the impacts of so many of these laws and these pushbacks. As you saw the film and saw what your counterparts in the 1960s, went through, I mean, one of the more striking details was, I think at one point, the women of this organization actually started performing the abortions themselves, deciding that they couldn't find enough doctors and that they could provide this kind of care. I like to think we're not at that stage right now where it's going to come to that. But can you talk a little bit about where you saw connection with those predecessors and where you think maybe things might have gotten better?
Yeah, I think our connection is that, for me, I feel the legacy is about creating grassroots solutions for people who want to take back control of their bodies, their lives, their communities. And this is how you get the right answers to the unique circumstances that everybody lives with. And so the support is more specialized and comprehensive. You're taking it into account the entirety of someone's life that isn't necessarily taken into account in bigger established systems. You either often have to fit into their idea of a patient, or you don't, and you're left behind, or you're treated poorly. But with that legacy is also, additional work for populations of people that are already doing a lot of unheralded, unpaid, underpaid labor, women and people of color. So in my conversations with people in our organization and people other partner organizations that we work with nationwide, there's a concern that so much work is being put on volunteers who have been doing this for years. And if we take into account Jane and Sister Song and others, we're talking decades that we're still working on this one problem that we've known about for a long time. You know, don't get me wrong, the motivation, the dedication and knowledge of these people is my inspiration, and it like physically gets my adrenaline pumping when I'm creating mutual aid systems with others. But it's, you know, it's also burnout city, baby. It's hardly a sustainable model for fighting an incredibly powerful anti-choice, anti-Black, anti-immigrant force that's about to appoint the most right-wing justice to SCOTUS, who is a woman that is working to remove rights from women. It's like that strong. So I do believe that we need to keep coming up with the solutions for ourselves outside of these systems that already exist. And that means functioning a bit outside of capitalism, but we also live inside capitalism, and we need to sustain ourselves, our coworkers, with the resources we need to lead the full lives that we're advocating for the clients that we're supposed to be in community with.
Right.
Yeah.
And there is so much work that needs to be done. And of course, part of that work is also making sure that you're engaging the next generation of activists to kind of, you know, continue this movement just in the way we've come from the 1960s to today, and looking ahead to who the leaders are going to be in the years to come. And there is this new generation right now that is coming of age, and they are leading movements and they are driving social change. And Devin, I'd love to hear from you, you know, what you think, what you would like that generation to know about the reality of abortion that they're about to inherit, and what they need to do to ensure that abortion access, that abortion remains accessible.
Yeah, absolutely. I thank you so much, Galena, for having us, by the way. Yeah, I think it really goes back to Diana's point. So we are working off of a long legacy from groups like Jane and Sister Song. We're here and we're looking at abortion. I think while the work has not changed, I think the public external conversation has shifted. So, you know, I think in the time of Jane, a lot of it was about being pro-choice and making sure like people had the option for abortions. What Jane did was make sure that not only did people have options for abortion, that they actually had access to it, right? And I think over the years, we've gotten to that space where we're starting to examine not only the ability of folks to have abortions, but what it means to actually be able to make it to an appointment and have all the resources you need and to live your life. And that all works within the framework of reproductive justice. So I think that the beautiful thing about this generation is that I think there is like a deep understanding of that. And I would like that conversation to become more public, because you see politicians and even celebrities talking about, you know, the history of abortion or what they think they know about abortion. In reality, there is a deeper history and there's a richer history there. And I'm hoping that the activists that we have in our generation and the people that we have coming up speak out on that, you know, and kind of drown out some of these outdated, I would say, conversations about abortion. And we really start to look at it more holistically, as in like, this is a part of my choice to live my life, have control of my body, and have all the resources I need to live. It's more than just abortion. It's so much more than that. And, you know, I do think there is a real threat here. I like to think that there's levels to this. So what we do is very grassroots, and, you know, from a like higher level, with what's happening with the Supreme Court, it makes me very concerned. But we also just have to think about, you know, legacy and consistency. So Justice Ginsburg had almost 3 decades of work in the Supreme Court. There's a long way to go. So we just have to make sure that we're holding each other up and taking care of each other. Community care is very vital in this moment. And yeah, I do think young people are starting to understand that a lot more now. But I think they're good. I think they have some things figured out that that we actually are, like, I'm still working on. So
I remain in awe of how confident they are in raising their voice and making demands, and I find it incredibly inspiring. So we've already already heard the word Supreme Court. We've heard the word Roe. We've heard Ruth Bader Ginsburg. We knew this was going to be a part of the conversation tonight, and we actually already have our first audience question. So I'm going to throw to that. I'm also going to remind folks, because someone did raise their hand, you can't actually speak directly to us, but if you do have a question, we want to get to it. So please drop it in the Q&A icon, and I will make sure to ask it of the panelists. But for now, we have one question up. How different do you think the legal framework would be if the case that reached the Supreme Court had been the case of a woman who wanted to have her baby and was being pressured to abort so she could keep her job? So I think the question is, what if the case that the Supreme Court actually ruled on was not the Roe v. Wade case, but was a case of a woman who didn't want to get an abortion, but risked losing her job if she didn't get one? Do we think that that would have made a difference at all, because it might have established a different legal framework or precedent? Does anyone want to tackle that?
I'm unsure, but I do believe Ruth fought a case like this. That was a woman in the military who was being pressured to abort to end her pregnancy. But I don't know if I have a good answer to what the legal landscape would look like now. I think either way, we would still have forces that are trying to control our bodies. And I think our system is designed in that control over our bodies depends a lot on the people in power, the partisan politicians that are in power at the moment, which makes me feel like the fight is just going to be pretty long. But yeah, I guess that's my answer to, like, any legal landscape would still have pretty powerful forces trying to control my body.
Andrea, you looked like you were going to say something. Yeah.
Yeah, it was mostly now just piggybacking off of what Diana said. I'm not a lawyer, and so I don't specifically know the legal framework, but I think if Roe didn't happen, I'm sure some other case would come to the point where we would have a similar decision, but it all comes down to control over women's bodies. There's been countless cases of that we don't talk about necessarily, but about forced sterilization and things like that, that are also horrible in a different way. And it all comes down to how politicians are trying to control our choices. And it's kind of what, like Deb said, it feels like it's a scary time when it does come down to what politicians are in power, and it feels like it's going to be a never-ending battle. But we have to put our faith in organizations like MAC and other grassroots organizations that are fighting the good fight and trying to help people day to day.
And speaking of ways we can help, our next audience question is, what are ways that OB/GYNs or other health professionals can get more involved with grassroots organizations in making effective change? So really, how do we connect the grassroots work that's being done with the healthcare profession? Diana, Devin, do you want to take that question?
Yeah, I can speak to this a little bit. Yeah, so as a coordinator for MAC, we support clients on a daily basis, traveling to, from, or within the Midwest. And I think that a key part of our work is working with clinicians and making sure that, if they have patients that they're working with, and someone is wanting to get an abortion or wanting to travel to get an abortion, don't have access to that they can reach out to us, and we can build that relationship. So I would say one way really is relationship building, and I'm sure we can provide our information if folks want to reach out to us and just start to talk about that a little bit. But I would say also too, like one thing that folks can do within their own organizations is make sure that the care that they are actually providing is safe and equitable and, affirming for the folks that are coming in. So I think there's like two aspects to that. So there's getting connected with grassroots organizations, but also looking at and examining the ways that what you're doing may not be as empowering to patients, and making sure that you're looking at that and changing that within your own organizations. And there's a lot of resources out there. For example, I know Diana and I have mentioned Sister Song. I feel like that's a really great place to start. Like, how are you talking about abortion access? How are you talking about the care that you're providing to patients, contraceptives, things like that. So that's a big element to it as well. But yeah. Please connect with us if you're
Yeah, and I would think that like the biggest feedback that we get from our clinic partners is that they are also understaffed and stretched thin, and they have their unique challenges. But there is an organization that advocates for them called Abortion Care Network that is really wonderful and is really great for healthcare providers. I would suggest that OB-GYNs should look them up and join their cause.
Fantastic. I love all of these resources. Thank you both for sharing those. We were talking a minute ago about engaging that next generation, and our next question is from a law student who wants to work in reproductive justice. I love hearing that. And this student wants to know what your thoughts are about the efficacy of fighting legal battles when it's really the folks on the ground who are doing the work to secure abortion access. So how can the legal community help you in that battle? It's interesting because in the documentary, someone actually says, Roe is meaningless. And I think that there's been this growing sentiment that really it's what's happening in communities, it's what's happening on the ground. And also it's meaningless because if you can't get access to an abortion, having, the law say that you can get one, it's, there's a real disconnect there. So if you have a young law student looking for ways to help, what is the legal assistance that could be more valuable for you?
Well, we're based in Illinois. We support people throughout the Midwest and sometimes in the South. But in Illinois, there was a coalition of pro-choice organizations that helped get the Reproductive Health Act passed and signed into law. And there's currently organizations that are also a part of the legal fight to repeal parental notification in Illinois. And the organization there that's really spearheading that is ICA, the Illinois Caucus for Adolescent Health. We also partner with the ACLU Judicial Bypass Project, and they should have several chapters or a chapter in every state. Hopefully, I don't think it's every state, but they're all over the country that you can plug in with and volunteer with them. There's also If, When, How. There's a legal advocacy for abortion rights. And yeah, it really depends on like where you are, what your state's laws are, what sort of fights people are doing on the ground in your area, and just plugging in and learning about those organizations and what kind of supports that they could use.
Clearly, the Supreme Court is on everyone's mind, and with good reason. Andrea, Sydney, I was really struck in rewatching the film over the weekend by the scene where in 2018, the news of Anthony Kennedy's retirement from the Supreme Court prompts, what one person calls an emergency situation, because of course now President Trump is going to be able to replace Anthony Kennedy, and to see truly the fear that engendered in so many of the folks featured in the documentary. And of course, if that's an emergency situation, what is the loss of Ruth Bader Ginsburg? How do you even begin to describe what that is about to potentially unleash on us?
Good question. I feel like, when it comes to the Supreme Court, and especially with a Republican president and 3 justices now that we've had leave, each time it feels more and more frightening. And I think to bring that back to the last question too, it is definitely scary when we look at Amy Coney Barrett's past remarks on Roe v. Wade and what she thinks is, I think I read something that she basically said, like, trap laws are maybe we won't reverse Roe, but trap laws are kind of what we should be going for. And I think that also brings us back to what this law student asked is really, we have these grassroots organizations working to kind of route people to where they can access care because of all these trap laws. And doing research for this film, I kind of focused on the Midwest because that's where both of these groups are mainly focused, but it's never ending, the trap laws of each state. They're so deep and there's so many, and they're dealing with waiting periods and parental permissions and forced ultrasounds, so many different things that make access to this care so hard for so many people because of traveling, or because you maybe don't know you're pregnant until down the road. And fighting against those at the state level, I think, is going to become increasingly more important, because Illinois is protected, like Diana said, because of HB 40 and other protections that they put in place. But I think South Dakota or North Dakota has a law in place that if Roe gets overturned, then it's immediately illegal. And so really looking into those state laws and how you can help at a state and even local level is going to just become increasingly more important as we see the Supreme Court going farther and farther right.
I think it's also important to point out, especially talking about misinformation and those trap laws, is to bring up the concept of pregnancy care centers. And especially in terms of law, it was ruled by the Supreme Court that if you have religious reasons, you can provide inaccurate information, which is why those centers will have like forced or offer free ultrasounds and then actually tell a client that they are not as far along as they are, so they might miss that deadline. And I think it's important to keep that education up and to like pay attention to the Supreme Court and pay attention to what those rulings are, because those laws might start changing really, really rapidly at the state and national level.
It's pretty clear we're all bracing for things to get worse, which brings me to the next audience member question. Is MAC doing any kind of scenario planning based on what happens with Roe, what happens with the Supreme Court nominee? You know, how do you begin to wrap your brain around what might be coming, even as you're trying to, you know, contend with all of the challenges you currently face?
Well, we have been planning for years. We were anticipating June not going our way, and it barely went our way. Like, it's like John Edwards's decision was not hopeful. And then, so we expect our numbers to like rise, the need to rise in the states that surround Illinois and the South. And so we're built for this. You know, we're built for getting people to places that have abortion care. And with COVID, it was sort of a test run. I keep telling people, like, the need just went up dramatically, not just the number of people, but the types of barriers that we had to work to get past. You know, plane and train and bus routes were shut down, hotels were shut down, or they were at a limited capacity. Like the clinic capacity also went down as people were figuring out how to be safe and secure getting care. And, you know, we did it. We just got everybody involved and did some crisis management and learned a few things. We worked with other organizations in like Texas and Louisiana when their anti-governments were trying to shut down abortion care, and we were able to quickly move folks to the places that they needed to be in collaboration with other organizations. So it's right now, it's really about connecting with the network, making sure that your systems are are a go and secure, and we are all in agreement about how to best serve our clients, and just creating those collaborative spaces so that we can bounce ideas off each other, problem solve together. And like it was wonderful being able to work with more and more folks across this country and get to know them and their unique challenges in their areas, and making sure that we do connect people to the care, and we did. And so we're going to continue to do that. We're going to continue to increase our capacity to serve more and more people. That's what 2021 is going to look like. Just how do we support each other in this work, and how do we make sure that the support that we give clients is comprehensive and of quality, even if the numbers go up, and they will, but
Yeah.
we're ready.
Sure. And I understand, Devin, you're on call tonight. I understand it's been quite a week in terms of just demand for services. I know you're on the ground with all of that. Can you talk a little bit about what's going on and why the demand has just intensified so much?
Yeah, so it has been a very, very busy week. We've had a lot of people actually coming in and talking to us last minute. I think I want to say that I can pinpoint why that's happening currently. I think there might be a few factors, if I were to guess, with the election coming up and things like that. People are maybe a little bit nervous about talking to other folks about seeking abortion care, and maybe they're going to the clinics directly, and the clinics know that we're one of the main people that they can refer folks to. So I would say a lot of the requests that we're getting are a bit last minute, more than expected. And then I think, we're still dealing with COVID. So folks are still trying to navigate in this space and do so safely. So I think as long as COVID's here, we're going to have folks that maybe are a little bit hesitant about going to their visits, and a lot of back and forth and things like that. And they just need folks to help them navigate. And then also too, with COVID comes more unemployment. The economy is not the best right now. So people are stretched. And, in addition to procedure funding, they need to think about all the other aspects of their care. So how you're going to get a ride to your appointment, how you're going to travel from one state to the other, whether that's a flight or a train or a bus. And then also, food costs and things like that. There's a lot of factors that go into getting an abortion. I don't think people always think about that in that way. So with that, I think people looking out for more resources, they're looking to us to kind of support that piece. So yeah, I would say that those are probably some of the things that we're seeing. I also think that it's just very, I'm used to kind of the highs and the lows. When people come, we're available. When, it's lower, we're still here. So yeah, like Diana said, I don't worry too much about any sort of like quote unquote disaster planning. I think I worry more about us just being consistent. And I think we're really strong. And like Diana said, we're built for this. So I don't think there's really any concerns, about what comes next, because we plan on, and we have the constant discussions, and we have the relationships to know that we work within this ecosystem, and we're going to continue to do that, no matter what we're facing, whatever's ahead of us.
Well, those are certainly very inspiring words, and I continue to be inspired by our audience because everyone keeps kind of offering up help and wanting to help. So we have someone who didn't have a question but a comment, really kind of touting Planned Parenthood's new lawsuit in North Carolina, which is aimed at removing trap laws, and really believes that the states all the other states should be following suit, because it is, as we've discussed, probably going to be decided at the state level, as we move forward. But one particular question is, and I'll put this to the storytellers, Andrea and Sydney, does it help the cause for more women to be open about their own abortions? And this audience member is saying that, remember when Betty Ford was open about her, battles with drinking, did that kind of, and that kind of change the conversation. Could that help to change the conversation? I know that there are a lot of great organizations that are encouraging folks to share their abortion stories, and I find that incredibly inspiring. Do we think that that is a path toward moving the needle?
I think it's definitely, I mean, it can't hurt, really. I even when making this film, I had a number of friends or people I know that when I had talked about making this, told me that they had had abortions that I didn't know about because they were in college, what have you. And it's just, I think it's become something that even if people aren't necessarily ashamed, it's just not something you bring up if you're not like lifelong friends or something. And but through like learning these stories from people that I know, and seeing things like Shout Your Abortion, and other abortion storytelling techniques, I think it shows like this isn't an issue that only affects certain people, or if you live in the suburbs only affects people that live in the cities or something like that. It's affects people all around you. It affects everyone with a uterus. I think I've seen a lot of things. Everyone knows someone, everyone loves someone who's had an abortion. And I think if we took this as an issue that's not something that is kind of removed from day-to-day life and realize that it's something that affects people every single day, and it's a big decision and it has a lot of financial repercussions and things like that, it could be something that does help move the needle just a little bit.
Yeah. Shout Your Abortion is amazing, by the way. Everyone should follow their Instagram. It's wonderful.
I agree. And speaking not just, or to sort of build on that kind of storytelling, I'm also intrigued by how we message around abortion. Something that stood out for me in the film was, I think it was someone from MAC used the phrase easy abortion access. And it struck me because I realized that so often when folks are talking about abortion, it's in this very kind of shrouded language of, well, I support abortion, but I want it to be safe, legal, and rare. And that was a mantra that certainly some politicians adopted for quite some time. And even, you know, if you look at the current political conversation, no one is really saying the abortion word. And you know, for me, I wonder, you know, how do we get to a place where we can talk in terms of we should have easy abortion access instead of feeling like we have to couch it in all of these kinds of euphemisms and ways that make it sound like we're not actually supporting bodily autonomy, because I think that that contributes to this overall feeling that abortion is not something that we should be talking about as a human right or as a part of healthcare. And I'll put it to anyone who would like to take that question on.
Yeah, I think I can start with that, and I'm sure other people will have contributions too. But you know, relating back to the previous question too, as a storyteller, you know, I kind of have to believe that telling those stories more breaks that taboo, is having that conversation. And it's a lot of what film can do, like this conversation with Undue Burdens and with our film. And I think in terms of breaking that taboo and making abortion more of a destigmatized topic, really comes around education as well. And a lot of what gets lost along the way of people who don't like abortions is that comprehensive sex education helps bring that down. And in terms of the conversation around that, that's also taboo and also isn't, you know, want to be spoken about. And so I think telling more of those stories and making it more humanized versus like, you know, misinformation picture. If you hear it, you know, from person to person, you know, if you open up, chances are that person will feel more comfortable opening up to you and have that conversation.
Yeah, and from a MAC perspective, we're more all of our work goes into our one-on-one client relationships. And so we want to make sure that we're affirming and we're just making sure that the client knows that they're making a decision that's right for themselves, and it's perfectly fine, and we're supportive, and there's absolutely no judgment involved. We're just normalizing the experience for them as much as we can. I don't know if Deb wants to speak a little bit more because she's a coordinator and is a coordinator right now this week. But yeah, we're very focused on the individual unique client and making sure that they feel supported and not ashamed of what they're doing.
Yeah, I mean, people will always need abortions, and they'll always, and that's just going to be a part of life. So I think for me, especially being a coordinator and supporting our clients, you know, it's very important to talk about it in a way that makes folks understand that it's totally normal and that we want them to feel empowered in their choice and not feel that they are doing something wrong. We we always want to make sure that we're centering the individual and your feelings, any external feelings, any friends or family members that may not align with that are not what's important. What's important is the person getting the abortion. And I feel like that's from the MAC perspective. I guess from like more of a like public perspective, you know, I think that I feel like people just need to understand that abortions will always be here. Like people will always need abortions. They'll always seek abortions. And that's something that is important for folks to understand and for us to elevate that. I don't think that there's anything wrong with that. That is a part of your choice to parent, to not parent, to live the way that you like and have the family that you like. So yeah, I feel like I feel like Diana explained from the MAP perspective pretty well. We really just seek to center those folks and make sure that they understand that this is a normal part of the process, that abortions are safe, and that we want to make sure that they have access to them, and that we will do what is necessary in order to make that happen for them. So we don't want them to think that we are bringing in any judgment or any, you know, make them feel insecure or anything about what they're choosing to do with their bodies.
Great. And I'm going to take another audience question and yet another person looking for a way to help. So incredible. This person is asking, are there any organizations or clinics that have volunteer opportunities via a virtual platform that can support reproductive justice efforts? And of course, in the age of COVID, you know, a lot of folks, you know, not really venturing out and trying to stay safe. Are there virtual opportunities that anyone is aware of that we could perhaps steer someone toward?
I feel like there's always donating. Donating is always helpful and can always be done virtually. And I see Diana and Dev kind of thinking of more specific ways. So I can't think of any specific organizations off the top of my head, but
we don't want to discount financial support. Always very helpful. Getting
financial support and just like sharing the word, like we were saying, like supporting these organizations like publicly too, and sharing your support for abortion helps move the needle a little bit.
Yeah, you could do virtual viewing parties with your friends of undue burdens and just talk about the issue and talk about it with your networks. Like we were saying in the other question, like storytelling, just talking about it, normalizing it does a lot. And there are a lot of organizations that are doing webinars now. Sister Song is one. ARC Southeast has been doing them, and they've been really informative and educating. So I would say look to those organizations that are doing a lot of webinars, and they do also talk about other ways that you can support. But like Andrea said, like all of these organizations also need a lot of financial support right now as the need increases exponentially.
And we actually have a recommendation from someone in the audience as well. So thank you. But apparently in Washington, D.C., PPMW has a developing leadership program and an ambassador program. And Planned Parenthood apparently has similar programs at other branches as well. So that might be a resource to connect with if you're looking for a volunteer opportunity. Thank you. Andrea, I wanted to ask you, the movie, you conducted most of the research and did most of the reporting, in that 2018 period. Here we are 2 years later, so much has changed. If you were to make a movie today about abortion, what do you think, what would the angle be? What would be different about it? Where would you even begin? Or would it be the same story?
I feel like the hard thing about abortion is that it's similar, like similar things are happening, but it's just like more on top of it. And I think like COVID has been particularly challenging for both clinics and people seeking abortions, people supporting people seeking abortions, and then just more things with the Supreme Court, obviously, as we've talked about before. Yeah, I don't know. I feel like there's such a deep well of people that are working in this space. You could easily like look at other groups and how different, because I mean, this film looks at Jane and then also MAC, which is a practical support organization, but there's also abortion funds that just fund people's procedure specifically. And then there's lots of like groups that work like Shout Your Abortion, work on like consciousness raising. I guess that's more of like a 60s term, but like work on getting the word out. So I don't know. It would probably be similar because I've always been interested in Jane and in the work that Mac's doing, but there's so many other ways that it could be approached, and there's a lot of the same issues that, I mean, in 2 years have not been solved. It's just been people working to try to be that stopgap solution between access and just meeting people where they are, basically. So but there's a lot of other great films about abortion out there and about abortion access, and I'm actually working on a series with another director right now that is hopefully going to come out later on in the next year or so, that's about other activists working in the abortion space. So yeah, it's a deep well of
good stories, that's for sure.
Yeah.
Diana and Devin, being on the front lines of this, is there an abortion story you would like to see told? Is there an angle that you think doesn't get enough coverage, or that folks are not paying enough attention to?
I know from my perspective, I think that, I really appreciate what Andrea did with Undue Burdens. I think something that we don't hear as much about, or I don't see as much about, is practical support, which is really what MAC does. And there's a lot of amazing groups. NOAF out of New Orleans is doing some really great work. Bridget Alliance out of New York is doing some really great work. And it really focuses on the perspective of like, okay, you covered the cost of your procedure. How do you get there? What are all the resources that you need in order to actually get your abortion? I'd like to see, and I'd like to hear the term practical support be commonplace and people to think about it from that perspective. We work as an ecosystem and every element is important. And I think, practical support is really a key piece. I don't want to like toot our own horn, but I think that's something that we want people to understand. And I think it's a really important piece to tell, especially from the patient's perspective. So not necessarily from our fund's perspective, but all the elements and pieces that people need to consider when they're getting the abortion, and how difficult that can be, and how many setbacks they can experience from just having to figure that piece out.
I think you're right. I think most folks are not aware of the complex logistics that go into getting this healthcare procedure.
If I would also,
sorry, go ahead, Sydney. Yes,
okay. I would also add to that in terms of, what story I would like to be told. A lot of the times abortion is really centered on women's reproductive rights, but it's not always just women who get abortions. And I really appreciate how language is turning to be a lot more inclusive. Gender nonconforming folks also get abortions. Anybody who biologically has a uterus, regardless of their gender identity, needs access and needs reproductive access. And so hearing that story told, or at least that concept discussed and recognized, I think is really important.
That's great. All right, and our audience is just coming up with incredible recommendations. So I feel like I need to read these off. If anyone is looking for volunteer opportunities, please write down this information. The National Network of Abortion Funds has a Movement Makers program. So I'm sure if you go to the National Network of Abortion Funds website or Google Movement Makers program, you can find more information out about that. You can also look up volunteering opportunities with any abortion fund or organization that works in repro. You can start a book club to learn about reproductive justice. What a cool idea. And this audience member recommends Killing the Black Body by Dorothy Roberts. And also is promoting MAC's newsletter, which is in the bottom of MAC's website, Midwest Coalition, accesscoalition.org, which is where all volunteer opportunities for MAC are posted. So thank you to everyone with those incredible recommendations, truly appreciated. I want to be mindful of time because we are coming to the end of ours, but I do, since we have such an engaged audience and everyone is looking for ways to help, I would love to kind of just go among all of the panelists and ask the question, with everything going on right now, all of the hand wringing, what is the one thing you think can truly make a difference, that can really change the course of this fight and lead us onto a path where we realize this, this dream of having bodily autonomy? What is the note of hope or opportunity that we can offer and that we can all kind of look at as a North Star as we continue these conversations? Diana, I'm going to start with you since you're largest on my screen right now. You're the big image.
What is the biggest thing? I would say, each region is very unique, and depending on where you are, just really learn about the organizations that are on the ground near you, learn about what they've been doing, learn about their history, and if you need a little support finding those organizations, you could email us info@Midwest Access Coalition, because we do a lot of collaborative work with people across organizations across the country, and we can find some place to plug you in based on your skills and your interest. Every organization is a little different because the geographical differences really matter, but there's always work to be done, and I think just hooking up with your local movements and starting the fight, joining the fight in your area is a good first step.
Great. Sydney, any thoughts, any notes of inspiration or hope you'd like to leave folks with?
Yeah, vote would be the first thing that I would suggest, but not just at the national level, at the state and local level. Pay attention to especially the judiciary, because that's where laws are going to be reviewed. That might be another trap law, or depending on where you are, could be really helpful for reproductive access. So to dig even deeper down ballot, and get your votes in. I know it's an imperfect system that we have now, but it's still important to participate. So that's what I would say.
No, and thank you for flagging the judiciary. I thought it was a particularly chilling moment during the debate last night when Trump noted that one of his signature accomplishments was that he's on pace to have more than 300 federal judges, and he kept calling them his judges, by the end of his first term. And you can see just all of the terrible implications of that statement. And it's something that we've been covering very closely at Rewire News Group because we realize the impact and we want folks to be aware. So thank you for flagging that. Devin, what would you like to kind of offer up as a note of how we move forward?
Yeah, this might sound a little bit dark, but then I'll explain. So one of the things I've been doing every morning is reminding myself that there are no heroes or saviors. So as much as, I'm definitely mourning the death of Justice Ginsburg and watching the news and kind of pretty horrified, I realize that there's work that I'm doing on the ground and that there are things to be done, and we should not wait for one thing or the other to really shift that. we should really work to do the things that we can in our space. So I think it speaks a little bit to Diana and Sydney's point. We need to vote. We need to help people. If they don't have access, get access to voting. I think access is a really key thing, you know, in all aspects, and make sure that you all are paying attention to what's happening locally. I think being very tuned into the movement around you in your area, local abortion funds, clinics, things like that is going to be really vital in this moment, and making sure that you're plugging in and doing your part. And there's also levels to this. So I think a few of the Q&A questions had to do like, oh, well, you all are doing grassroots work and I'm a lawyer. How, you know, you all are doing the quote unquote real work. It's like, no, there's levels to this. So we all need to be doing our part consistently, and we need to make sure that we're taking care of ourselves and making sure we're taking care of each other. So, you know, the more people that are involved and the more that we can lean on each other, you know, I think the more this is going to be sustainable. And, you know, if you have resources and you can reallocate those resources, please do. So plug into your local abortion funds, pay attention to what their needs are. And if you can contribute, that makes a huge difference, especially in this moment, because the opposition is fighting with everything they have. So we have to be able to do that as well.
I love that sentiment that there is no hero who's going to save us. I saw a meme on Twitter the other day that said that the cavalry is not coming, we are the cavalry. And I think it's that same idea that it is on each of us to step up in this moment. Andrea, thoughts?
That segues perfectly into what I was going to say. Really, my main hope that the thing that people take away from watching the film is that, like, these are groups that have formed in the face of issues and have said we can be the solution. And yes, we can fight against trap laws and be worried about the Supreme Court and all these things. And exactly like Dev said, we need to have these things working at different levels, but you can plug in and you can help be the solution to a problem that you see in the world. And you can be those boots on the ground that are making that specific change. And I think it's easy to get, especially when you're getting barraged right now with different issues that are happening in the world, and it can feel really, really overwhelming. It's easy to like kind of cocoon yourself and cut off from those things, but plug into an organization. I mean, even if it's not abortion, if it's another organization or issue that you care about, plug in and be the solution to a problem that you see, because there are no heroes that are going to save us. We can't hope for that perfect law that's going to come around and make that change. We have to be the ones that really do that work, make that change that we want to see.
Thank you for that. And yet another suggestion on how you can be the change. Diana mentioned a group earlier, If, When, How. Someone from the Colorado law chapter says they're doing virtual phone banks. So if you're interested in doing virtual phone banks with If, When, How, the information can be found on their Instagram, which is at @ifwhenhow_Colorado law. And of course, we know that abortion is on the ballot in Colorado this year. So definitely looking for volunteers there. So with that, our time has come to an end. I want to thank our panelists and remind everyone that if you want to support in any way, you can go to MidwestAccessCoalition.org. You can also go to UndueBurdens.com to find out ways you can support the film Undue Burdens. And there's also a Get Involved link that links not only to Midwest Access Coalition, but to a number of other abortion funds for folks who are interested in supporting. And I will also remind everyone that Rewire News Group is also a nonprofit, and we are the only media outlet that is exclusively dedicated to reporting on reproductive justice issues. So we thank you for supporting us tonight by attending this event. If you're interested in additional support, you can check us out at rewirenewsgroup.com/donate, or you can sign up for our newsletter or listen to our podcast, Boom Lawyered, where for those of you who are super interested in the legal aspects of this, we break it down every week. So lots of ways for folks to get engaged and be involved. And thank you by starting tonight with participating in this event. Thank you again to Andrea, Sydney, Diana, and Devin, and thank you all who joined us tonight. Have a good night, everyone.
Thank you all. Have a good night.
Bye-bye.
Thank you. Bye.